Thanks for having me here. My family's from Sri Lanka originally. Spent most of my life in the UK and Australia, and Singapore too, I guess. And I was in the finance space. I was in structured finance, leverage finance, iBanking for about 10, 12 years altogether, and just got fed up with it. And I had this anxiety for many years while working in banking in Singapore at the time, wanting to feel like I was doing something more purposeful and impactful, and tried dabbling with some side projects on the side, outside of work on a voluntary basis. Back in 2011, I happened to cross paths with a group of doctors, Singaporean doctors, who were doing some medical outreach work in Ladakh at the time in northern India. And they were just getting a lot of demand and pull from their colleagues beyond in the broader region. They were doing some primary eye and dental care and some surgical cataract and cleft surgeries. And I stepped in to formalize what they were doing, create an entity, like a nonprofit, fundraise, go on trips and collect data and report back, and did that as a side gig for about 5 years. We built up a pretty awesome team, like it felt really genuine and sincere, and we did hundreds of cleft surgeries and thousands of cataracts and distributed tens of thousands of glasses and things. And the whole time my day job just became pretty insignificant, and I just wasn't motivated at all. Just climbing the corporate ladder, and ended up signing up for a master's in public health at Harvard, and just took the leap to completely pivot my career and life. In the process of being a public health student, but being really interested in innovation and leveraging technology and some of the behavioral science I was getting exposed to at the School of Public Health, kind of followed my curiosities rather than try to get an internship or get a job at the end of it. I was just naturally drawn to the startup space, and just tinkering with like-minded people at the innovation lab. I just found my tribe in that community, and slowly, through a lot of blood, sweat, and tears, and luck and experimentation, like we built Vincere Health, me and Jake, my co-founder. And yeah, it's just been like a huge learning experience. It's still pretty early days, but we've managed to navigate some ups and downs. I think what I've learned is just being sincere about your intent and your curiosities, and trying to solve the problems you actually care about.
Thank you for sharing that. How did you get started working on a smoking cessation platform?
Yeah, so Vincere Health, we are a behavior change company, effectively trying to use a combination of remote monitoring technology and behavioral science, as well as clinical care, to kind of get people to change their smoking behavior, nicotine addiction, and address some of their mental health, social anxiety, social determinants of health, and basically address a population where there's just a higher prevalence of need. The company was rooted in that yearning to be more impactful and purposeful for the underserved. I think my time in the global health world with Global Clinic, the NGO stuff I was doing before, it really kind of highlighted the gap between the kind of the haves and the have-nots in healthcare on a global perspective, and the power of like leveraging some simple tools like smartphones and some fairly low cost monitoring devices and data to really help bridge that gap and get that leverage on being able to create an impact. And I crossed paths with Jake, my co-founder, at at one of the accelerator or co-working space, basically, and Jake had more of a domestic lean and healthcare expertise. He was many years a healthcare IT consultant with Medicaid in the US. We knew we wanted to make an impact for people at the lower end of the socioeconomic pyramid in this country, particularly, as much as I had a global mindset, you got to start focused, and I was happy to try and address some of the problems in US Medicaid and the kind of underinsured population here. And smoking was always a huge line item, a huge kind of expense in medical costs and loss of quality of life, loss of productivity, and kind of a cornerstone of several other really terrible diseases, and a huge risk factor for things like COPD and heart disease and diabetes and all these kind of scary chronic conditions that are going to drive like government budgets into the ground if they don't kind of get a handle on things. So this is kind of the starting point, kind of working backwards from an intent or a mission to try and improve the lives of and improve the health of people who are relatively neglected. And smoking also, I understood it because I'd grown up in Australia and the UK when in a time where it was still cool to smoke, and then suddenly you're addicted and you're using smoking as like a social crutch or emotional crutch. So I kind of knew the dynamics of trying to quit, and was curious about behavior change and some of the science around incentives and motivations. So yeah, we ended up kind of experimenting with this very narrowly focused use case, getting people to reduce smoking or quit smoking, and build out like a cool piece of tech to try and increase people's interest in quitting and increase their engagement in a program. So a component of what we built was instant financial incentives that were conditional upon proving some kind of health behavior. And yeah, we built out initially a very basic prototype to kind of reward instantly when someone did a breath test, and we could measure their smoking levels. And then if they were below a certain level, be able to deposit a bonus amount. So being able to very carefully configure instant rewards to drive engagement and behavior change. So based around that concept, we had to figure out what worked in practice, what worked commercially, how to kind of actually get people to pay for this, because that's usually the hardest part, particularly in healthcare. There's a ton of great research and great ideas to make people feel better or get better, but very few things get paid for. Like the payment piece is the toughest part. So being pragmatic about the business model and thinking about all the stakeholders involved in solving some of those things, or having a strategy to solve over a period of time, those were where my kind of finance skills or business skills kind of came into play. And then the public health side of things helps to know when to pull in the real experts who know what they're talking about clinically.